So you've been diagnosed with an otitis externa, or infection of the outer ear canal. Here's what you need to know and a bit of what you might like to know. So an otitis externa is an infection of the outer ear canal. This is the canal that leads from the outer ear inside. It's the canal that we are not supposed to put Q-tips into. That actually gets an infection. This happens when there's some kind of scratch or damage to the canal, usually when people who have cell phones with an earpiece get a scratch in there, or someone's using a Q-tip in there, or even just getting water in there can also lead to an infection, this otitis externa. Patients feel a lot of pain and itchiness inside the ear canal. The patients who are worst off are those who have immunodeficiencies. Those would be patients with diabetes, severe diabetes, or you're on chemotherapy. Those patients need to be watched closely, but healthy patients usually can get over it just fine with the treatment. And the treatment is antibiotic ear drops. Occasionally we use pills, but most of the time we just use the ear drops. Sometimes some patients have so much swelling in their ear canal that they can't even get the drops in. It's just closed off. In those cases, we will also use something called a wick. It's like a little piece of a cotton ball that we stuff inside what's left of the hole there, and then we put the drops on top of it. It expands and then comes into contact with the whole canal, and that way the medication is touching the whole canal to try and get rid of the infection. The most important thing you can do is to make sure that you do not get your ear wet. You do not want any water in your ear canal while you are still treating it with the antibiotics. So don't put your head under water in the bath, don't go swimming, try to keep it completely dry even when you're showering. It's very important to keep water out of there. You can also take acetaminophen, which is the same thing as Tylenol, or ibuprofen, same thing as Advil or Motrin, for pain if you like. Now, it should be getting a lot better with those drops or pills if you've been given them within 2 days. Expect to be much better. If you are not having a big improvement within 2 days, you need to come back to the emergency room. That's reason number one. Reason number two would be if you have spreading redness behind the ear or in the actual ear itself. We call this the pinna, or in front of the ear. If the redness is spreading, then you need to come back to the emergency room. And lastly, if you have drowsiness, a stiff neck, or confusion, that would be reason number three to come back to the emergency room. I'm Dr. Ratzma, and those are my discharge instructions for otitis externa, or infection of the outer ear canal.